can't believe it myself. Suddenly I'm up on top of the world. It should have been somebody else. Believe it or not, I'm walking on air. I never thought I could feel so.
Chemeketa EMS, one of the busiest community college ambulance services in the city of Salem. These paramedics have seen it all. No paramedics anywhere have a better relationship with their community, their patients, and co-workers, as well as the medical staff they work with day in and day out. These are some of the sharpest medics in the city, constantly training and reviewing their standing orders, all under the constant supervision of seasoned paramedic and EMS supervisor, Pat Donahue, who is always ready for action and dedicated to leading and teaching his troops.
I've been here for about 15 years. For the last 5 years, I've been a supervisor, and these guys got going with me. They're real good, and they know a lot of stuff, but they still have a lot to learn. I'm going to be dropping by every now and then today to check up on them, so make sure that everything's going smooth. Well, good morning, gentlemen. I'm glad to see you're all up and ready for a busy day today.
Thrilling article here.
Yeah.
Very good.
Well, I hope they're all wide awake today, ready for a busy day.
Oh, yeah. Do it.
Okay. The one thing that's going to be new today, we're going to start carrying a new drug, a vasopressin. You might have heard of it before.
Oh, yeah. I was actually just reading about it.
You were?
Yeah.
Good. What can you tell me about it?
Oh, well,
Nice, Cole.
Vasopressin promotes reabsorption of water by action on the renal tubular epithelium, causes peripheral vasoconstriction.
You're running at 15, Medic 15 today, Pat?
Yeah, Medic 15, and it's all been checked out. It's been running good. You had a busy day yesterday.
All right, let's hit the streets.
Okay.
All right. EMS on 3, guys.
Let's ride with veteran
1, 2,
paramedic
3,
Evan Van Otten.
Hey, name's Evan. Been with Chemeketa EMS now for about 7 years out in the street. Cole, great partner. You know, we're learning a lot together. He's learning a lot. It's never an easy day here. Geez, after the first call, my glasses broke, which is pretty intense. And you know, we've seen all sorts of stuff out here, and it never gets boring. I mean, that's why I love this job. Not a 9-to-5 kind of deal. You know, you're out here running calls. You never know what you're gonna get. You know, sometimes you're sleeping doing nothing. Sometimes you're out working harder than anybody else. So it's pretty intense, and I wouldn't do anything else. You know.
Medic 15, respond to a difficulty breathing with asthma history at the Union Gospel Mission.
Medic 15 copies. So it looks like we're going to be en route here to a respiratory problem. Sounds pretty typical, asthma attack. We'll see what it is when we get there.
Dispatch, Medic 3, cancelled by command and returning. Medic 3, cancelled by command and returning.
So we found this guy down at the Union Gospel Mission. He's got some difficulty breathing. We're just assessing his lung sounds right now. How's it sounding, Cole?
Hey, Evan, they're pretty crackly down the base. I think he's got a lot of fluid there. Keep breathing. Try and control your breathing for us. Hey, can't we give Lasix for this? It's a diuretic.
Furosemide, or Lasix, inhibits reabsorption of sodium and chloride at proximal and distal tubule in the loop of Henle.
It'll pull the
Hey,
fluid out
whoa,
of the
slow
lungs.
down though. What can we do first? How about a NEP treatment?
Oh, okay. Hey, I'll set it up if you throw me one from over there.
Here's the albuterol.
All right, albuterol. All right, cool.
What's that do, Cole?
Albuterol causes bronchodilation by action on beta-2 receptors by increasing levels of CAM, which relaxes smooth muscle, produces bronchodilation, CNS stimulation, cardiac stimulation, as well as increase in diuresis and gastric secretion.
It's really gonna help. You take some deep breaths. Here we go.
Here, suck on this. Just suck on it.
Take
Breathe
deep breaths
deep.
in with that. Is that helping?
Keep breathing. Good job. Good job. Hey,
All
I'm
right,
gonna
Cole.
drive, Ev. Let's
Let's go.
Medic 15 drops off the respiratory patient at the receiving ER. But before getting comfortable at base, the tones go off again. Medic 15 is responding to a suspected overdose at a location all too familiar to them. Even though this is a common call, no call is routine.
All right, so what we got here? This is a call. It came across as a unconscious victim. We don't know anything about him. These are the kind of calls we get sometimes. You know, honestly, this is a local. Hold on, this is a local transient hangout. So a lot of the time, you know, you never know what you're gonna get over here. A lot of alcohol, a lot of drug abuse. As you can see, our patient's completely unconscious.
Get over here.
You know, I gotta help. Just hold on.
Hey guys,
I got the IV and I'm giving some Narcan. I think
what's
it's a
going
heroin
on?
overdose.
What do we got
Some
here?
Narcan?
Yeah, it's a
Okay.
heroin overdose.
Oh, you want another? Well, how about Narcan? Competes with opioids at opiate receptor sites.
Sir?
You
Sir?
there? Hello? He's coming too. He's coming too, sir. Whoa, 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 whoa. Settle down. Whoa. Whoa. Hey.
Hey! Hey, go call the cops!
Hey. Whoa. What just happened? What's that? You gave Narcan,
There he
right?
goes.
Oh, whatever.
It'll wear off pretty quick.
Let's talk with rookie paramedic Cole Van Essen.
Alright, so my name is Cole Van Essen. I'm a brand new paramedic here at the ambulance service. You know, I've been a paramedic for a while, but this area is really new to me, and some of the drugs that we're carrying are pretty new. You know, it's a great job, it really is, but it really takes it out of you. I mean, I go home at the end of the day as tired as you can be. I mean, I used to work construction, and I've never been as tired as I was when I worked construction. But this job does it every day to me, day in, day out. You know, no matter what we're doing here, I go home tired. I think it's mostly probably the stress. You know, when you deal with people that are hurt or sick, or you know, a lot of death, we deal with a lot of death. It kind of takes a toll on you. And honestly, I don't know how some of the guys do it. I'm pretty young, and maybe I'm just a stud. I don't know, but I handle it okay. Yeah. It's a good job, yeah.
We joined Medic 15 responding to a report of a single-car high-speed accident off of a country road. EMS supervisor Pat Donahue has arrived on the scene and reports one critically injured patient.
Hey, Pat, what do we got?
We got an injury here. I don't know if I got any breathing on this guy.
Is he
I'm holding the C-spine.
You don't know if he's breathing?
Yeah, check his...
Whoa, whoa, he's drilling. Careful. He's not breathing. Hurry up, Evan. We need the backboard. I think we're just going to scoop and go. I think we're just going to scoop and go, man.
Okay.
We'll have to take care of him in the back. Do you have a
Okay.
pulse?
Yeah, slight pulse.
Weak pulse. Come on, Evan. What's taking so long? All right, I'm going to open the door. You ready? Let's get this door open first. Oh, man. He'll grab C-spine from the back, Pat.
Okay.
Oh, he's got it, he's got it.
C-spine.
Let me throw this collar on.
You're doing good, Cole.
Am I doing everything right, guys?
You're doing great.
That's great.
This is the first time I've used this kind of collar.
Yeah, that's always the first thing.
How's that look?
Looks perfect. All right, you guys take his leg down there. I'll keep C-spine on his head here.
Hold on, hold on. 1, 2, 3.
Okay, you got C-spine?
Got these back.
Go.
Go. Let's see. I want to shift him
You want to move him over?
first. Yeah. And 1, 2, 3.
Pull the board down. Okay. All right. Ready? Okay, lift it up, go Pat. Good. We got him. Let's go, guys. We got a firefighter driving.
Oh, awesome.
Hop in, Pat.
Hop in, Pat.
All right, so this guy was in a motor vehicle crash. It was icy out. Looks like he was about 60 miles an hour and went into the ditch. He's hardly breathing, so Pat's bagging him here, and Cole's going for an IV because we're going to intubate him as soon as Cole's got the IV going. You got that IV, Cole?
Getting there, hold on.
How's his airway, Pat? Air going in?
Here's going in. I got you fine.
You got it?
I got flash, we're good.
So what are we giving first, guys?
Well, we gotta give a sedative, so we could give Valium or we could give Versed, right?
Diazepam, or Valium, causes CNS depression, decreases seizure activity by enhanced presynaptic inhibition.
What do you think, Pat?
Let's see. Let's go with Versed so that for the retrograde amnesia.
Sounds good.
Okay.
Here's your Versed.
Oh, midazolam, or Versed, decreases subcortical levels in the central nervous system, may act on limbic system, may potentiate GABA by binding to specific benzodiazepine receptors.
Ready? Alright, Versed's in.
What are we giving next, guys?
How's the bagging coming?
Going good.
What are we giving next?
We gotta paralyze him, so let's get the sucks
Sucks?
out. Man, am
Sucks.
I the only guy here that knows this stuff? Come on.
I'm checking you, Cole.
Jeez.
Succinylcholine prevents muscles from contracting by prolonging time during which the receptors at the neuromuscular junction cannot respond to acetylcholine.
Alright, sucks is in.
All right, Pat, on 3. I'm going to tube him, okay?
Okay.
1, 2, 3. 3 in.
Yeah, you want to listen to those lung
Let me
sounds?
get lung sounds. Breathe. 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 Nothing over the stomach. I think we're good.
All right, let's just keep going to the
Good
hospital.
tube. Good tube.
Medic 15 takes their motor vehicle crash patient, code 3, to the nearest trauma center. They would make it to base, but right when the boys got comfortable, the tones go off once again. This time they will be responding to a male complaining of palpitations and weakness.
So we got toned out to this guy. He's having rapid heart, you know, and he's not feeling good, so we're going to see what's going on.
Oh, he's right here, guys. Hey, what seems to be going on today?
Well, I guess a lot of commotion here, but just watching the Hawks game, Seahawks in.
His heart's really moving, guys.
Okay, I'll give him a
I
monitor.
just didn't feel very good, so I came in here and I don't know. I don't know if there's anything wrong with me or not, but I guess you check it out. That'd probably be a good plan.
Yeah,
I'm
okay.
going to take a look at your heart here.
Are you having any pain at all?
Oh, well, maybe a little bit. I guess my chest is tight. Kind of
Yeah.
tight around here, maybe.
Okay. Okay. Do you have any other past medical history? Have any cardiac problems
No,
or
no,
nothing like that?
No, I'm
Okay.
in good shape.
Do you take any medications at all?
No.
No, nothing like that. Are you having any trouble breathing?
Well, a little bit around. Yeah, a little bit. Yeah.
Well, you keep touching your neck. Is there like
it's
pressure there or?
Seem. I get. Yeah.
Yeah, okay.
Pressure, yeah.
Yeah.
He's really flying on the monitor.
Hey
Oh,
guys,
man.
what do we got going here?
We don't know, Pat. He's just flying on the monitor.
Yeah,
and
we're not really sure.
He's
what
just
to
feeling
do
kind of
with
sick.
Okay, why don't you try some adenosine?
Adenosine.
Adenosine. Why didn't we think of that?
I don't know.
Adenosine slows conduction through the AV node and can interrupt reentry pathways in the AV node.
Hey, Cole, you want to get an IV while I'm
Yeah,
going up the drug?
sure, I'll get an IV. So,
I don't know if I need all of this stuff.
has
guys,
anyone
but,
ever
you
has
know,
anyone ever told you you had an abnormal heart rate or anything like that?
No.
No, have
I
you ever had a
remember.
fast heart rate before?
No.
No? Okay. You got that drug ready?
Yeah, it's ready.
Okay. Okay, I got an IV.
Okay. So there's your adenosine, here's your 20cc flush that you need
Yeah,
at least.
push
You want
the
to push the flush?
Yeah.
And I'm going to
Okay.
record and see what comes across.
Okay, we're going.
Okay.
Chin.
Jay.
Turn to AFib.
AFib. Have you ever heard of AFib before?
No.
No one's ever told you that you had AFib or anything?
No.
Okay.
Whatever that is. No.
Okay. Well, how about we give Cardizem?
Diltiazem?
Yeah, that's another name.
Yeah,
for
okay,
it.
yeah.
Cardizem.
Okay.
What does that do again?
Diltiazem inhibits calcium ion influx across cell membrane during cardiac depolarization, decreases SA and AV node conduction, AV node refractory period is prolonged, cardiac contractility and peripheral vascular resistance is decreased, produces relaxation of the coronary vascular smooth muscle.
All right, it's in.
Okay, it's starting to slow down, looking more like a normal sinus rhythm.
Okay.
Let's go ahead and start getting to the
You
hospital.
feel any different at all?
Oh.
Kind of lightheaded, maybe,
No,
or?
yeah, maybe a little bit. I
Okay,
don't
you
know
just feeling
what's
sick.
going
All
on
right,
here.
we'll get you to the hospital.
Oh, okay.
Let's go get the gurney. Pat, stay with the patient.
Okay.
Medic 15 transports their heart patient to the nearest hospital for treatment, but will quickly become available so they're able to respond to their community's emergencies. Medic 15 responds to a call they get very often: chest pain. Cole and Evan will have to put on their detective hats to attempt to discover the cause.
Let's go take a look at what we got.
Let's go. This is a typical chest pain call. We'll see what we got. A lot of people think they have chest pain. It's really nothing. Hey, whoa, sir, what are you doing out here?
What's going on today?
Whoa. Hey, let's have a seat. Why don't you sit down?
There we go.
Go ahead.
What's
There
going
we
on
go.
today?
I'm gonna get a blood pressure.
Chest
Can you describe it to me?
Oh, it feels like an elephant is sitting on my chest. Oh, and it's strongly radiating into my left arm.
All right.
Oh.
Hey, whoa.
Give
This
me-
is classic chest pain.
Yeah.
Oh, yeah, it is, man.
He's having a heart attack, maybe.
Hey,
What?
Hey, are you allergic to asprin?
Oh, I
You
don't
guys
know.
got here.
you got a chest pain. Looks like he's having a heart attack.
You allergic to aspirin?
No.
All right, I'm gonna give you 3 aspirin.
Yeah.
Just go ahead and chew those up.
Aspirin blocks pain impulses in the central nervous system and decreases platelet aggregation.
Blood pressure 130 over 80.
All right, good. How's his pulse?
Oh,
That's
It's
flying.
strong. It's good. It's
flying.
pretty fast. Yeah.
All right, let's go ahead and get this guy
Oh.
transported
Let's
to the
get him in.
hospital.
Let's get. All right. So we forgot to ask you earlier. How's that chest pain? If you had to rate it, like on out of 1 out of 10, if 10 was the worst pain that you've ever had, how would you rate it?
That's a lot.
Like what's a lot?
Like-
Give me a number.
I don't know, at least 59 and 100,000.
Okay.
Oh!
Hey, why don't we get some oxygen on you?
Yeah.
Okay. Hey, I want you just to nod your head yes or no for me. Okay. Have you ever had any cardiac history before? Have you ever had a heart attack?
I think I almost had one.
What?
I almost had one. They told me at the hospital. Oh!
Okay. Has anybody in your family ever had a heart
My
attack?
brother!
Your brother?
He's
has
dead!
He's dead. Okay. Hey, Evan.
He's
you ever-
dead!
Oh, whoa, settle
No.
down. Hey, listen to me. We're gonna get you some medicine to help you feel better. Okay?
Oh, it's cold!
It's
Oh, it's cold!
It's gonna give you a bit of a headache.
His pressure's
All
still good.
Oh.
Pressure's still good.
It's on
You
the
got
monitor.
IV.
My chest hurts.
He's normal saline, normal
so
sinus in the
listen.
monitor.
Hey, so
Okay,
we got
I'm
an
gonna
IV.
start driving.
All right, thanks, Pat.
Yeah,
Take
IV's
it
in.
easy. IV's in. Pressure good.
Pressure's fine.
Okay, listen, we're gonna give you some medicine that's gonna help your chest pain. Okay, it's gonna give you a bit of a headache. But have you ever heard of nitroglycerin before? Yeah. Hey, do you take nitro?
I don't know.
Little pills.
Uh-huh.
Okay. Okay. Well, do you take any today? No.
I don't know.
No, okay.
No.
No.
Good, let's give him that.
Let's-
Nitro.
Okay, we're gonna give you some nitro. Listen, I'm gonna spray it on your tongue, and it's gonna open up your vessels. And what that's gonna do is decrease the workload of your heart, so maybe the pain will go away. Okay? Ready? Open your mouth. Stick your tongue out. Up. Spray? Okay, go ahead, put it down.
A
little bit of a headache?
Does my head hurt?
Does it burn a
Does
little?
it burn? Does it burn?
It's gonna be alright, it's gonna help. That helped that pain at all?
No!
Still a 10 out of 10?
I'm gonna give you one more. Stick your tongue out. Ready? Okay, Tim, go ahead. Breathe.
Is that helping?
Try and breathe slow. Hey, try and settle down a little, okay? I know this is hard for you, but everyone has chest pain some point in their life, okay? And everybody deals with it.
Hey, Cole. So in about 5 minutes here, if his pain's still 10 out of 10, what do you think we should do?
Well, we're going to want to go on to morphine.
Morphine depresses pain impulse transmission at the spinal cord level by interacting with opioid receptors, produces generalized central nervous system depression.
Let's call.
Whoa.
Why don't you go ahead and call into Dr. Shuley and ask him permission for it?
Okay, I'll call Dr. Shuley. Yeah, this is Medic 15 to Dr. Shuley. We need a medical consult. Yeah, exactly. Hey Doc, this is Cole Van Essen with Medic 15. Hey, we have a 55-year-old male here. He's having some 10 out of 10 chest pain. We've already given him aspirin. We have an IV in place. We gave him 3 sprays of nitro. He's still having chest pain. It's, no relief. His pressure's still good. He has a real strong history of cardiac, and on the monitor he's showing a sinus tach. We want some permission to give maybe 2 milligrams of morphine, maybe a little more, depending on what we need for relief.
Well, what about the pressure?
Pressure's good.
Sounds good. Sounds real good. Yeah, go ahead and start with 2 milligrams of morphine. Yeah, you boys have never let me down. See you guys in about
Thanks,
5
Doc.
minutes, all right?
Yep,
All
we'll see you in a
right.
bit. Okay, bye. We're good.
Okay.
He said start with 2, and then if you need more, go ahead and step it up.
More.
Alright, 2
It's gonna
milligrams
take a
in.
little while. It'll take a little while.
Medic 15's chest pain patient is rushed to the cath lab at the hospital because of a suspected heart attack. In downtime between calls, let's catch up with Paramedic Cole.
Yeah, so, I was telling you earlier, I'm kind of a new paramedic around here. Well, my partner, Evan, he's a great guy. He's taught me a lot, We've been through quite a bit together, actually, in the time that I've been here. But sometimes, man, he's kind of hard on me. He's probably good. It's probably helping me learn better, but, sometimes I just want to ask him, like, why do you wake up on the wrong side of the bed today? I mean, really, like, take it out on me? I don't care. Does he have a dog to kick or something? I mean, seriously. I don't know. He's a good guy. Just sometimes, this place is stressful enough. Really. Why does he have to add to it? I don't know. Whatever.
The break is over, and Medic 15 rushes to the aid of a diabetic patient.
Hey, what's going on?
He's a diabetic and he's acting kind of weird.
Okay, okay. Sir? Sir? Let's go ahead and get a blood sugar and get a line started.
I'm going to grab his BP too real quick.
Okay. Yeah, his sugar's 20.
His sugar's 20? Alright, well, how about I just get an IV real quick?
Alright, you get the IV. We're going to go ahead and give him D50.
Oh. Dextrose. Needed for adequate utilization of amino acids, decreases protein, nitrogen loss, and prevents ketosis.
25 grams. I'll give the
wait,
sugar
don't we
up.
want to give glucagon?
Oh. Glucagon. Stimulates an increase in blood concentration of glucose.
Nah, we don't need to give glucagon because if he doesn't have any stored sugar, it's not going to release it.
Okay.
Hey guys, what we got going here?
Looks like a diabetic problem, Pat. Want to go ahead and get a blood pressure?
Yeah.
This
On
is the
this arm
guy.
over
This
here?
is the same guy that we had last week. Remember?
Yeah. How you
Yeah,
doing?
we just gave him D25 last time. He came right out of it.
Yeah.
All right, so we got an IV. Okay. D50's in. Let's give him a few minutes. Get a blood pressure for us there. Sir, I think he's kind of waking up a little. Sir, you okay?
No,
You doing all right? You know where you're at? My name's Cole. I'm with the ambulance. We think your blood sugar was really low. We gave you some sugar, and I think are you starting to feel a little better, or waking up?
Oh, I got a terrible headache.
You know where you're at?
You didn't have anything to eat today, did you?
No, I don't remember.
Yeah.
Well, this is a real typical response for diabetic. They come out, they're kind of almost like a postictal, like after they have a seizure. You give him a few more minutes, he'll come around, he'll know where he's at. We'll tell him what happened, and it'll all be normal for him.
How's that blood pressure, Pat?
Yeah, 120/70.
Good.
Perfect.
Yeah, if he took his insulin today and he didn't eat anything,
Have you had
then it's
anything
going to
to
cause
eat
this
today,
problem.
do you remember?
No, I don't think so.
Yeah, that's what I
No?
thought. That's what I thought. Well, let's go ahead. You feel like going to the hospital and getting checked out? It's probably a good idea, just in case, because that D50 might wear off
Has this ever
that sugar.
happened? Has this happened to you before?
Yeah.
Okay.
Well, let's go. I'll go get the stretcher. We'll load it up and go.
Sounds good.
After dropping their patient off in the ER, Medic 15 returns to quarters. Cole and Evan will sit down with Pat to review the latest call and wait for the next big one.
Okay, guys, I think that call went real smooth, that last one.
15, respond to a report of a man down in his garage at 815 North Cherry Street. Neighbors on the site, no other information.
Like 15's en route. Let's go, Cole.
Copy, Medic 15 en route
Okay.
to the man down at 815 North.
Yeah, Pat, it's a good thing you're here. We're going to need you for this one. Yeah, I hope so.
Is he breathing?
Sure.
Back down.
Not breathing.
It's bagging.
No pulse.
Okay. Start getting an IV ready, Pat. I'm going to do a quick look at the paddle.
Save him.
He's in V-fib. Everybody clear him, okay? Everybody clear.
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 Okay, charging up 200. Shocking. Still V-fib. Everybody clear.
Watch your leg. Watch your leg.
300. Shocking. Everybody clear still?
Clear.
360. I'm going to shock one last time. Shocking.
Still V-fib?
Still V-fib. No pulse. Alright, I'm going to start doing CPR. You got that IV? Let's go ahead and give epinephrine, guys.
Epinephrine. It's a beta-1 and beta-2 agonist. Produces bronchodilation and cardiac and CNS stimulation.
Let's throw in a tube real quick.
Okay. Let's see if he's got the epi in.
Okay.
Come on the ambulance.
Okay,
Okay,
on
why don't you
board.
take over bagging,
Take
Pat?
over bagging for me.
Yeah.
I got a whole fridge full of popsicle in my basement.
I got a tube already. Ready?
Okay.
Go.
Oh, yeah. Oh, that's gross. Oh, don't put it in there. Oh.
Did you get it?
Got it.
He did.
Pat, did you get the lungs CPR?
Me?
And bagging him?
He did. Can I tell him? You guys have one of those big bags for him and stuff? I'm just going to take
Tube's good.
Tube's good.
Okay. So, why don't you start? I'm going to take a quick look here, see what we got. Still in V-fib. I'm going to go ahead and shock. Everybody clear him. 360. Ready? Everybody cleared. Shocking. Still V-fib. No pulse. Let's start bagging him.
He's kind of a pretty man.
Okay. I'm going to take over this, doing the CPR. You do the bagging, Cole. And why don't we get, what, lidocaine? Amiodarone? What do you think, guys?
Amiodarone. Prolongs duration of action potential and effective refractory period. Non-competitive alpha and beta adrenergic inhibitors. Increases PR and QT intervals. Also decreases sinus rate. Decreases peripheral vascular resistance.
Well, we gotta give an antidysrhythmic.
Max
so-
sulfate?
Oh, hold on 1 second. Magnesium sulfate. Essential for muscle contraction, some enzyme systems, and nervous transmission. Causes central nervous system depression and controls seizures by blocking release of acetylcholine at the myoneural junction. Also, decreases sensitivity at the motor end plate and acetylcholine, and decreases excitability at the motor membrane.
How about lidocaine? That's an easy one.
Yeah.
We need to decrease automaticity of the heart.
Okay.
That would be good.
Make it less irritable, right?
I would give him
So
1.5 milligrams per kilogram lidocaine, Pat.
Lidocaine increases electrical stimulation threshold of the ventricle, his Purkinje system by acting on sodium channels, which stabilizes cardiac membrane and decreases automaticity.
Lidocaine's on board.
Good. Okay, let's take another look.
50 kilograms is like 110 pounds.
Still V-fib. I'm gonna go ahead and give a shot, guys. Everybody clear him. 360. Everybody clear? Charging. Chalk. Oh, he's in assistantly. I'm gonna change the leads up.
He's not dead.
He's still in assistantly. Is there a pulse? No pulse. Okay, I'm gonna start doing CPR. Let's give atropine.
Atropine. Okay.
Atropine blocks acetylcholine at the parasympathetic neuroeffector sites on AV and SA nodes, increases cardiac output, heart rate, and by blocking vagal stimulation.
1 milligram. It's on
Atropine's
board.
in.
Good.
Let's give about 30 seconds.
What else can we do for this guy?
Well, we could give another round of epinephrine.
Yeah. Pat, why don't you take over CPR? I'm gonna call the hospital and see what the doc thinks.
Okay.
I know. How's the CPR? Compliant? We got a pulse. Good job. You're doing good.
I'm just gonna go see if he has any sandwiches inside.
These neighbors are crazy.
So you've tried it all. Well, go ahead and give a round of sodium bicarb. If you get them back, give dopamine. Just follow your assistantly protocols. And if you don't, just think about calling it. You can't get them all, boys. It's tough. All right.
Poor guys.
It's about time for another round.
Dr. Shuley says try some sodium bicarb.
Okay.
And do another round of epi and atropine, and if you don't get anything back, call it. Otherwise, if we do, don't forget the dopamine.
Oh, yeah.
Dopamine causes an increase in cardiac output, acts on beta-1 and alpha receptors, causing vasoconstriction to blood vessels. Beta-1 stimulation produces inotropic effects with increased cardiac output.
Alright, I'll take over CPR. I want to get another round of epi up.
Okay.
He's still assistantly on the monitor.
Okay. 1 epi. It's on
Yes,
board.
Okay. Let that circulate.
We're
Get
good.
that atropine
You want
ready
me to
too.
step out of the room for a sec, all right?
Actually, sodium bicarb next.
Okay, I'm gonna go get my dog.
Okay.
Sodium bicarb helps correct metabolic acidosis.
Okay. Sodium bicarb
Okay.
on board.
Still in assistantly.
Let's give it a little bit.
Yeah, and let's just
Take
get
a
that
look
one
at
last
where-
round of atropine in, and then we'll
Okay.
do another couple more minutes CPR, and then we'll call it, I guess. What a jerk.
Okay.
Let's put that atropine in.
1 milligram of atropine. It's on board.
We're still assistantly, guys. Let's call it. So,
Alright.
1300.
You want to go talk to the neighbor?
Yeah, we'll go talk to the neighbor. Let's start cleaning up,
Good
guys.
luck. I'll clean up. You go talk to him.
Sir, I'm sorry to break this to you. Thought we lost him.
You lost him?
Can I have... No! No! Oh, God! I'm gonna miss that dog. I used to come over and play, and we'd get out the peanut butter, and we'd make sandwiches.
I hate these calls, guys.
Yeah.
Not every call turns out well. A fact that paramedic Evan knows all too well.
Yeah, those are tough calls. When you lose people, you know, that's not what most of us sign up to do. But we get a lot of saves, and when you do that, you know, you're floating on air. Nothing feels better. There's no better drug in the world. So.
To me, I can't believe it myself. Suddenly I'm up on top of the world. You should have